Cialis, and there we go. Sorry about that. It's just water.
You want to watch it for me? Yeah.
And Muse is another one. The Muse is a suppository that goes into the opening at the end of the penis, into the urethra, and kind of melts in there. And the medication then happens more locally. The Caberjet is the same medication as the Muse, only it's an injection. And people say to me like, oh my gosh, I don't want to inject my penis, thank you very much. It's a teeny, teeny, tiny needle, very similar to what a diabetic person uses to inject their insulin, that really, really fine mosquito kind of needle. And the medication, it's kind of great in a way because you're keeping the medication right where it needs to go, and you're injecting a tiny little bit with a teeny little pinprick at the base of the penis. And the nice thing is with both that Muse and the Caberjet, with the suppository and with the injection, if you have high blood pressure problems that prevent you from using the oral medication like the Viagra and the Cialis and those, if we're keeping that medication in a little bitty living space where it's going to be used, it's not coursing around through your stomach and all your blood system to elevate all of, make all of your blood vessels dilate. So the way that all of these work, and the reason why I want to tell you how they work, is because it makes a difference on whether they'll work for you or not. A lot of people spend a lot of money on these medications, and they're not cheap. And they start off with 25 milligrams of Viagra, and then they go to 50 milligrams of Viagra, then they go to 100 milligrams of Viagra, and their doctor's like, well, maybe you're not taking it right. But the problem is, if someone has had those nerves cut down in the groin area, or if they've had the blood vessels scarred in that area, and the nerves won't tell the blood vessels to dilate, and the blood vessels can't dilate and engorge and make that penis hard, we can throw thousands of dollars of Viagra at that penis, and it's still just going to just hang out and be flaccid, okay? It just isn't going to go anywhere. So if you truly, truly cannot get anywhere near an erection, even you wake up, 3 o'clock in the morning, if you have no erection happening, you're playing with that thing for 10 minutes with the silicone lube, and it's still not going anywhere. We're probably not going to really make it any better with a whole bunch of money worth of product. Because if those blood vessels won't engorge, they're not going to engorge. It's worth a try, though. And I think a lot of times people will say, well, I used the orals and they didn't work for me. And they don't try the suppository or the injection. And the thing is, remember, if we take a pill, it's got to go to our stomach, it's got to be absorbed, it's got to get to the right place, and then we've got to get our mind on that and get that working. And so sometimes putting something right where it belongs can make a difference. So it's worthwhile trying some of these things. That's a talk with your doctor and or primary care provider, and seeing what you want to try. Most people, they hear about injections and suppositories, and they're like, I'm out of there. And then I move on to surgical implants, and they're like, if I'm not going to put a suppository in my penis, I probably don't want an implant. But I want to show you what they look like anyway. So I find this a little intimidating, but I have had patients who just swear by this working so well for them. But if you've got those blood vessels that aren't going to dilate and engorge, if you've got those nerves that have been cut, there's something that we can do. Not me personally, the urology surgeons.
No,
but what is so fascinating to me is this whole little contraption really works for people. So, what does this look like here? Go in the right direction. Okay. So, here's what this thing looks like, and I'll send it around so you guys can actually, check it out. But what happens is this little pump gets implanted down into the scrotum, like where a testicle would be. Okay? And then this little pump gets implanted up behind the pubic bone, kind of up by where the bladder is. It gets filled up with sterile saline, and so this, imagine that this is now kind of like a water balloon, and these guys are empty. And these guys get put in the cavernosa of the penis. So, believe it or not, your cavernosa are about that big, no matter how big things look on the surface. So let's imagine we've got this kind of flaccid penis sitting here with these guys in it. We've got this down in the testicle area, and we've got this water reservoir that's implanted up here. What happens is there's a little valve that you push, and then when you pump, the saline from this pump pumps into these little guys, and they make everything all hard and erect. And then, when you're done using this little puppy that's erect, you reach down, and in that scrotum, you push the little valve again, and the saline drains back into the little bowl. And then everything goes flaccid again. It doesn't affect the ability to urinate. It doesn't go anywhere near the rectum at all, so it isn't bulky and blocking anybody from pooping. But it's very effective. The surgery is about a 45-minute surgery, and the recovery is a couple of days with an ice pack. It's not a painful surgery at all. And I've verified this not just with the surgeons who put it in, who I never trust to tell you how much pain it's going to be, but I verified that with patients. And patients actually, if they kind of get over the ick factor, which is really the big thing, they really like it. And it's a good solution if there's that erectile dysfunction that's mechanical. It's not, oh gee, I don't really feel like it, and it's not, I just haven't had enough Viagra, but it's actually things don't work. This can make things work. So I'm going to just have you feel it and send it around and check it out. Just because most people have never seen one. They hear surgery and they're like, I'm out of here. The other thing, and this is so funny because, how many boys at the back of whatever magazine, saw these penis pumps in their youth and went, it will make me larger. And actually they don't make you larger. They make you larger temporarily. But there are many, many of these on the market. They used to be covered by Medicare, and then the Medicare rules changed and they weren't covered by Medicare. Now some of them are covered by Medicare. I don't know how to tell which ones are which, but I know with a prescription, some durable medical will pay for it. Again, we're talking about pumps and things, right? And the idea is, if you keep it together, but if you pump this puppy up, it creates a vacuum. So again, if you've got that penis that if it gets a little bit of encouragement, the blood flow will come in and it will stay hard. You use a water-based lubricant in here, apply this over said organ, fix the valve, go in the right direction, and give it a little pump, and it kind of vacuums things up. It's kind of like giving somebody a hickey, right? It just pulls up a little bit of the blood up in there and creates some engorgement. If you don't put water-based lube on there, it's not going to do you a lot of good because it's not going to come out. So put lube on it first, and then it'll slide out and stay hard. But again, most people have seen these in the back of a magazine and never seen one in person, so you send it around. This isn't a very high-tech one. There's some much cooler ones out on the market, but this one is lightweight and fits in my bag, and I can send it around. But there's lots of them out there. Again, you can get them online. I do recommend that you go to a place that sells them and take a look at them, because some of them are pretty cheap and cheesy, and you want to make sure that you're not just wasting your time and money. Other things, vibrators. A lot of times guys kind of think that vibrators are for women. mostly probably because they're shaped like penises, most of them. So I can totally get where you get that idea. But the thing is that vibrators are really nice. How many of us, love to sit in the vibrating chair and have it massage our backs, right? But so vibrators can be nice as well. Send one this direction.
Keep it visible.
Let's see if this one's charged. Let's see if this one will turn on. Maybe it has been on in my bag and has run out of juice.
Don't drain the battery.
I didn't bring my charger.
That's enough now. That's enough.
There we go. Okay, you guys, I'll tell you the TSA approved story on this. So Lilo, the one that's coming around there and the one that I think is out of juice here. But they actually have an airplane mode.
Airplane.
So this
Give it to Jack.
But what happens with the Lilo one that's going around, the pink one, and then the other one that's out of juice, the purple one that's going around, when you push the little stop button and you just hold it, it will blink. And when it blinks, then it will not come on in your luggage or your purse. Which obviously didn't happen with the purple one that's going around because its juice is gone. But the nice thing with vibrators, though, is that what do? It's kind of like boiling water. It makes the nerves and the blood vessels and everything kind of warm up and vibrate, and sometimes that can help stimulate an erection. Or if the erection isn't happening, it can just feel really good. Men can actually orgasm without ejaculation and without an erection. The orgasm piece, that nerve response, can happen with a flaccid penis and without actually ejaculating anything. But the way to get that to happen usually is with some vibration. So you just have to experiment with where you put the vibrator and what feels good for you, but you can actually get to orgasm without those things. So these are the things that if we kind of bring this stuff out, bring the toys out, throw them on the table, open up the conversation, there's some opportunity for some things to shift. Also, clothing can make you feel sexy. Books and movies can provide fantasy stuff. Love notes. I love the idea of love notes, where you get a little journal and you just have it closed up and it's on the bedroom dresser with a nice pen. You can't borrow the pen for the grocery list because it won't ever come back to the bedroom. But and the only thing you can write in it, you can't write, you forgot to take out the garbage again. Okay, that isn't what goes in there. You only write positive, sweet things to each other. Honey, I sure loved the way you looked this morning. Thank you for doing this for me. I really appreciate it when. I remember that time back in 19 whatever, and we went to that place and had sex on the beach. You can write those kind of love notes in there, and then the other partner gets to come and take a look at it and go, wow, that's sweet. I can write a sweet thing back. And it can kind of start opening up some of those opportunities for nice conversations that can lead other places. All right, so avoiding the topic won't get you very far, right? We've established that. Talking to your partner or potential partner and just saying, you know what, I think I'm probably not going to be able to get a very good erection. I might not be able to maintain it. But I'd sure like to see what still feels good. Okay, that's a start, right? You've got some ideas of what's happening. Remind each other stories about times when things were a little more sexy and see if you can kind of spurt some interest there. And then certainly if you're just not ready for that, talking to someone you trust and asking questions and saying, what could I try? So on your slide set, and I've given my slide set to you guys, so you've got some of these books, the written materials. I brought one other book by Virginia and Keith Lakin, which I've read this, and it's nice. It's a nice read. It's a little more medically than I would have usually, but Hope for Couples Facing Loss of Sexual Intimacy. There's a number of different ones that are up here on the list that are good. And then resources on there, I have Madeland in Seattle, I have Shebop in Portland, and then also Shine at Seattle Cancer Care Alliance, and I brought some little brochures for them. Shine sells many of these products. I've worked with them over the last 5 years to say, stock this stuff so that people don't have to go into a sex shop to buy it. You know, that you can walk in there and pretend that you're just looking at cards and then like go down to the sex area. And they're really good about helping people find things. And then certainly your healthcare providers and things, they're going to be uncomfortable because most people don't ask. They're just like, you know, I'm just not going to bring it up. But if you bring it up with them, they can help you, whether it's referring you to a urologist about implants or writing prescriptions for Viagra or something. They know how to do this stuff, they just don't. And if they don't know how to do it, you have them call me and I'll teach them. Okay. And so the new normal can be pretty darn good. It probably won't be what you remember from when you were 17, but what is, right? Even gum and ice cream don't taste the same anymore. but we can do better than we do by doing nothing. And I don't know if this is the last one. Oh, no, time for questions. There we go. That's my last one. So, ta-da! So ask me questions, and how are we doing time?
We're fine.
Really good. Okay.
Leslie, you're
Yeah.
a wonderful resource, but there's only one of you. So the reason I say that is that you know, you really know the topic and you're willing and very able to discuss it. So for a group like this, what sort of resources do we need to go online? Because most doctors and nurses that I've met are not nearly up to what you presented tonight.
Well, thank you for that. I have to say the survivorship clinics, so now down Providence, down, oh, is she Olympia? I think she's Olympia. Nora Mayer is her last name. Nora Mayer does survivorship down at Provo Olympia, and she's good at this as well. Up way north at Peace Health, Kelly, who does survivorship up there, she's really good. So the survivorship clinics, we've kind of earned our stripes, and a lot of that has been that we've gotten together as a group, and we've been, you know, I've brought my kit, they've brought their kit. We go and hear Ann Cat speak when she's at events. And so we try to learn and things. So the survivorship clinics are a really good resource. The other really good resource is urology or men's health clinics. Now, not your oncologist, male oncologist guy, but your urology clinic. They're pretty darn good usually at sexual dysfunction and things. They're going to be a little more about the mechanics. They're not going to be so much about hold hands and, you know, write love letters. But they're going to know the nuts and bolts, so to speak, of the nuts and bolts of the mechanics and what to do.
And the
with that.
university has one of those, doesn't it?
Yeah, university has a handful of those, and then also, but Providence, St. Joe's, and
TG?
you know, yeah, TG will have a urologist, and you want to, you know, when you call to make your appointment, you want to kind of, you know, cough it up and say, I want to talk to somebody about erectile dysfunction. Because otherwise, if you're just saying, I just need to see a urologist, you know, you might get the person who's real wet behind the ears and doesn't really know what to recommend. So you do want to be kind of honest and just out there and say, I want to talk about erectile dysfunction because I've had prostate cancer.
Right.
And then they're going to give you somebody who knows what they're doing.
Thanks.
Yeah.
So do these people refer you?
Some of them do, actually. And it's funny, I actually have gone to a few different medical conferences and given similar lectures to medical providers that really, they are bringing it up because they don't know the answers. And so hopefully And they tell two friends and they tell two friends.
Yeah, I'm pretty fortunate, I go to the VA, and the
Mhm.
VA has a lot of resources.
Really good
All you
resources.
gotta do is ask.
Mhm.
And they'll give you when I first was diagnosed, they gave me a pamphlet about this thick,
Mhm.
everything you could ever wanna know about prostate cancer.
Yeah,
And then a lot of the after cancer is over and what to do.
yeah.
So,
The VA does a good job of that, and I think probably because, I don't know, just because you get, all those military guys around, they're gonna talk about this stuff, right? But, so I think they had to learn.
people get injured everywhere. So,
Exactly, exactly.
But, life doesn't have to end,
Yeah.
There's people out there that don't have no legs, and I can get around better than most people I know.
Exactly,
So,
exactly.
it's just amazing what the VA does. So.
And I can't, not that I don't get any kickbacks from ANCAT's books, but if you're interested in reading, I think that a lot of these kind of more medical-y books, it's like, great, but they're not readable, right? I think Anne's books are really readable.
I'm laughing at the Cialis commercial. If the erection lasts more than 4 hours, see your doctor. Why can't I see my doctor? No,
That's right. I'm gonna tell everybody.
really, I imagine that does happen in a very small number of cases. And what happens if that doesn't, if it maintains an erection for that length of time?
That is a great question. So okay, so you guys will never see those things on car lots the same again. But those things on car lots that look like a great big giant condom that's got like the wind underneath and it's like all up there doing its thing, right? So imagine that's kind of how the system works. If you've got that big fan on the bottom and the big tube and the air blows up in it. But in the male body, what happens is there's 3 main blood vessels that feed up into the penis, into those cavernosa, and the cavernosa, cavern, right? They're just this spongy tissue that fills up with blood and fluid, and that fills up and gets sperm. What the Viagra and Cialis and things like that do is they basically kind of cause a lot of blood vessel dilation, and then they close off a little bit the exit valve. And so what happens is if you get that erection that maintains for 4 or 6 hours, which isn't good, I mean, it's like having a tourniquet on, right? That's not a good thing. You go into the emergency room and they do, it sounds terrible, but they do a little bitty incision at the base of those cavernosa and manually drain them. It's kind of like the locks at Ballard. But they drain those down. Those teeny little incisions are about the size of like if you nick yourself shaving. They heal up really well. It doesn't mean you can't use the Viagra or something another time. But it's, if you know you're prone to that, you've been through that, most people are like, I'll do without things. But it can be, usually you see that with people that have taken too big of a dose. But some people are just sensitive to it, but most of the time it doesn't happen. Good question. Other stuff? Any of the ladies in the room with questions?
I'll just say this. Because of what my wife went through, we went to Leslie, and through the whole survivorship thing, what she's done is just a little snippet of the survivorship stuff. And as I said before, the emotional side of the healing is almost greater than the physical. So even if you had to pay, and I have no idea how much an office visit with you was, but it was an hour and a half of time well worth spent that we spent up at SCCA, getting all of the information not only for the present but for the future. And so I would just heartily say, go to her, book an appointment. The services she provides, for us it was just a blur of stuff, and I vaguely remember everything that was done to my wife, but I don't remember exactly, and she collates it and puts it all together, and it's just a wonderful, wonderful service. So like I said, this is a small section, and thank you for making it lighthearted but not goofy, informative but not graphic. So it was very, very well balanced, and so thank you.
I wasn't But I do have, because I have to tout my own self, but I do have some flyers from the survivorship clinic if people are interested. Treatment summary, care plan, we talk about lots of topics, including sex. So there's that.
Thank you very much.
You betcha, thank you guys. And I'll stick around for a while too if anybody has other questions.
Next month, we are fortunate to have Jonathan Wright, who is a renowned doctor from a CCA that specializes in exercise for cancer survivors. So he's going to come down and see him talking at a lot of conferences like we were talking about earlier. He'll be coming down to talk to us about exercise after cancer. And I think maybe John Gore might come with him too to give us a little update on what he's involved in. We're all happy to see him come down when he comes to our group. So that'll be in June, and then July we'll take a month off from business and have some fun at our annual picnic. And you'll be getting emails. Did everybody get the notice email this time?
Yes.
And also the reminder a couple of days ago? Everybody got the reminder? Because some people didn't.
I didn't.
I
For
did.
some reason.
I got mine.
You didn't get one, the reminder,
Yeah, I did not get the reminder.
and Jack didn't get it either,
I didn't.
Yeah, I get a reminder, I got the first one.
but not the reminder. Oh, that's really weird.
I didn't get any.
Okay.
Bob, one more thing that's happening in June,
Ah,
Friday, June 2, will be the start of the Tacoma Relay.
That's right.
And
right.
the Survivors Lab happens at 6 p.m. on Friday, June 2, Mount Tahoma High School. And after the Survivors Lab, there will be a free dinner for all survivors and caregivers. Now, that's pilot talk. Please show up. I'll have banners, flags for us to carry that lab, so everybody knows who we are.
Do we need to sign up with the American Cancer Society that would be there as a survivor? Or just show up and sign up?
Go ahead and go to the website and sign up. It's not necessary, no, you don't have to.
Okay.
It helps their accounting.
The only difference is, if you sign up and register, and you check in when you first get there, you get a bag of goodies, the t-shirt and
Yeah, that's
and all
fine.
that stuff.
Yeah,
If you
we're
don't
like
sign
that.
up or want to register, then, you just don't get
Yeah,
that.
I've collected these over the last 8 or 9 years, got one
Yeah.
for each year.
Yeah,
Yeah.
yeah, you get your survivors, you get a T-shirt.
Okay.
Different one each year.
What else is happening in June? You mentioned some other dates. I have something about June as well.
Okay, go ahead, John.
Well, also on 2nd of June is the first day of a 3-day Rock and Gem show that my club, the Puyallup Valley Gem and Mineral Society, holds every year at Swiss Park in Bonnie Lake. So I have the little flyer here announcing the show again beginning on June 2nd at Swiss Park. And we have 26 vendors, outside vendors, inside vendors, demonstrations, a kids corner, display cases, raffles. If you want to buy a raffle ticket, I have one. So see me before you go if you're interested in the information to attend. I have it right here.